Okay, so this is a case study form. You don't have to use this form. The aim and objective of this case study is that we discuss it and you understand how to do your client encounters. Okay, so this has been done by another student. So before, what I used to encourage students to do is take this form just for the purposes of learning, although it is absolutely not necessary to do it this way. This is just a way of doing it. So here is a case. Let's look at the person. It is a female in the Vata age. And why did she come for this Ayurvedic consultation? She had low energy. Right off the bat, you've just attended a class on Prana, Tejas, Ojas. What does low energy mean in terms of Pran, Tejas, and Ojas? Is it an issue with Prana or Tejas or Ojas? You can unmute yourself and talk. It's easy for me to, otherwise I'm checking and switching before windows. So does anybody want to unmute and tell me? Let's make it an interactive session. Nobody's muting themselves.
Low prana?
Yes, yes, absolutely. It's low prana. Now, it would also be low ojas if it was low energy all the time and they were always getting sick. But if it is just low energy and they're not getting sick, then it could be, they could be anemic. They could have ama. There are many, many reasons for low energy. Or maybe they're just not feeling well. Maybe it's season change. So once you know the symptoms of a person, they're saying this is what's happening, that's when you start asking question. Is this low energy happening? What time of day is it happening? Is it happening in the afternoon time? It is related with tejas then. It's related with pitta. Is it happening in kapha time of day? Usually you will find the low energy is hitting people at, hang on a second. Low energy is usually, what is the vata time of day? Anybody? You can just unmute yourself and make it interactive. Anyone?
First thing in the morning?
Yeah, that is first thing in the morning. You should actually be rested. Yes. So if there is low energy first thing in the morning, the reason can be ama or low pran. But if there is low energy or you feel like low energy at between 3 to 6 p.m., does that mean a person has low pran? Yes or no? Now remember, that is a vata time of day. Okay. So 3 to 6 p.m. not necessarily mean, that means during the day I wake up in the morning and I'm full of energy. That's what they're telling you. And, usually by, between 3 and 6 p.m. I'm really low energy. I have to have coffee. So that doesn't mean that they have low energy. Does that make sense to you? Low energy means that as soon as they wake up in the morning, they have to consume caffeine and stimulating beverages or take ginseng or whatever just to get on through the day. And they are even more like they're completely wiped out by 3 p.m. They can't even move. Now that would be low energy. Many, many reasons for that. It could be ama, or it could be low prana, or if it is low, or they might be anemic. So these are the questions, do you tend to be anemic? They'll usually know, because when people have been to the physician, sometimes I've had people who are like chronic low energy and wiped out, and I look at them, it seems like, I'm like, you need to go to your physician. You might have anemia, and get it checked out. But in the meanwhile, you want to start eating foods that build blood, that nourish Rakta Dhatu. Sleep difficulties. Now, sleep itself, if a person is not sleeping, let's see. Next second is, if a person is, so we have established this could be low prana. That means it's related to vata dosha. Sleep difficulties, we don't know is it. What time of the are they unable to fall asleep? Do they wake up early? Are they a light sleeper? Are they waking up 10 times during the night? So what kind of sleep difficulty? We just don't know this. You've just received the form. These are the symptoms. But usually this could be related to pitta or vata. Usually kapha have the opposite problem. They sleep too much. The only time a kapha person will have problem sleeping if their nose is congested and there might be times when some kapha people will suffer from sleep apnea, because usually that is also, anatomical reason for shape of nose and whatnot for it. But congestion is related with, if it's a kapha person, then sleep difficulties usually to congestion. Otherwise, always sleep difficulty, number one reason is vata. Number two reason may be pitta. So if it's a woman, she's menopausal, she's having hot flashes, that's a pitta reason. So because it's also accompanied by low energy, I think this is more, seems to be vata issue, but we don't know. Gastric reflux. I can hear myself echo. Can everybody unmute themselves, please? Somebody's unmuted, so okay. When you're ready to talk, then unmute yourself. Otherwise, keep yourself muted. Otherwise, there's an echo, okay? Anybody? Either in the chat window or you.
Jess.
Yes! I don't know who that was, but I'm clapping for
Stephanie.
you. Okay, great. So here we go. That could be an issue with Tejas. That could be issue with Pitta. Excellent. But we don't know, because depending on how, this is just right off the bat when, you're approaching someone and they have certain symptoms. So, okay. Generalized aches and pains.
Can I ask a question?
Yeah.
So is the kapha dosha more prone to low energy?
No, that is not true.
Okay.
Anybody can have low energy. Usually people will have low energy, if you've been working too hard, if you have anemia, you don't have enough oxygen in your, usually, in fact, if there's any dosha that is related to low energy, it would be vata. Because one of the clinical reasons of having low energy is you don't have enough oxygen in your blood, right? And oxygen is prana. We talked about high pran, low pran. So from clinical perspective, pran is oxygen. It's in the hemoglobin. So the energy number one dosha that you look at is vata. You look at the prana. Generalized aches and pains, anybody? This could be anything. This could be kapha. This could be vata, pitta. We don't know. So we will just leave it there. Elevated blood pressure is what dosha? If you were in the class yesterday, we talked about the client who was on ACE inhibitors and was on beta blockers and had blood pressure issues. And we talked about which dosha, sub-dosha, is associated with blood pressure. Anyone?
It's not Vyana Vata, is it?
It is. That's excellent. Thank you. See, I'm putting you on the spot deliberately because this is how we learn. Mild memory difficulties and concentration. What is the one thing you could do, you have the green case study form that we sent you. If you have it open, it actually is a cheat sheet. If you think about it, if you look at this, just look, Vyana, blood circulation, blood pressure, Samana, peristaltic movement. So it's kind of like a cheat sheet. So if you have that, go ahead and get it. I'll wait for a minute and have it in front of you, and then you can do a little, you know exactly what's happening then. So that's a great cheat sheet. All right. So elevated blood pressure would be Vyana Vata. So we've already established low energy is maybe Vata, sleep difficulty maybe Vata, gastric is Pitta. We don't know what pain is because it can be Vata, Pitta, or Kapha. Blood pressure is usually Vata. Memory and concentration is usually which subdosha?
Pranavata?
Yes, absolutely. Absolutely. Let's put prana here. So let's count how many. If you count, I'm trying to say this is how we are determining Vikriti. Low energy, low prana, 1, 2. Seems to me the aches and pains should also be Vata because everything else is Vata. 1, 2, 3, 4 Vata issues. So Vikriti is high Vata with And let's go and we'll break it down further. Let's go and
Could generalized pain also relate to the ojas as well? 'Cause I
absolutely.
remember her mentioning that a few times.
Absolutely. Yes. Well, your ojas is, remember, pran, tejas, ojas, they don't kind of function, you know, ojas is the container of pran. There's a whole thing. It takes you 6-7 months to understand this, and you're trying to give it to you in one class. But yes, absolutely. They could be, like I said, they could be one symptom and it can mean many, many things. So we have to probe further. So this is why, let me save this. Do you want me to save this for you? Okay, I'll save this and then clear it. Let's go down and look at this case study. Sensitivity to the sun. Pachak has acid reflux and sadhaka some unable to process too much information clarity occasionally. So three, and we don't know if this person is anemic because has a low energy, right? Because we haven't probed it further and that person is not in front of us. But there are 3: sensitivity to the sun, pachak, hyperacidity, acid reflux, sadhak, occasional memory lapses there, right? And this is why I created this. It's a really good cheat sheet to get started. You don't have to show this to your client. You can keep that on the side, just to look at all the symptoms. But it's a really, really great place to start. So I think we send it all to you with your enrollment packet. Make a couple of copies of it. And every time you do a client encounter, use this. Eventually, you won't need to use this because you will have all the subdoshas on the tip of your fingers. So let's see. Let's see if all the subdoshas of Vata with this person had low energy, lack of clarity, fatigue, feeling tired all the time for many, many years. This has been going on for years, and has high blood pressure, has relationship issues, and has udana, speaks with a very low voice. So you have, let's count, three subdoshas of pitta are out of balance. 1, 2, 3 subdoshas of vata are out of balance. And joint pain and asthma she's put. Now joint pain can actually be kapha, pitta, vata, but if it is but specifically when it's related to lubrication of joints or dryness in the joints, then it is related to kapha. Avalambak, there's a lot of lung congestion, asthma. Now, asthma is of many types, which, you can't just say if someone has asthma, it is avalambak kapha. It is definitely related to avalambak kapha, but asthma can be a vata type, pitta type, kapha type, and so on and so forth. But, you can say, yeah, there is something going on with, again, avalambak prana. This is also connected with prana. So there's a lot of pran coming up. And so these are the issues that have come up. I'm going to animate it again. We already know what this person's prakriti is. So vikriti, you have 3 subdoshas of vata, 3 subdoshas of pitta, and 2 subdoshas of kapha that are out of balance, right? We're specifically talking. Out of all of this, the most important symptom that she has come to you for, and it affects everything and it's very systemic, is her prana. Her prana and avyana. So she has a blood pressure issue, and she has, I would say, her top issue that she's come. What we also have to address what they've come to you for. So let's look at the Agni. Agni, prone to acidity. Agni is Tikshna Agni. Now, in this case study, we have not asked if a person has Tikshna Agni. Yeah. So, high. Now, based on this information, the person is Vata Pitta. Pitta predominant and Vata is secondary. Right? So according to this person has done, Vata has gone up 4, Pitta has gone down, and Kapha has gone up. Do you want to change this? Just based on this. Agni is high based on acidity and acid reflux and whatnot. And we don't know what this person is eating. Maybe there is someone, this is just a general thing. So now you look at Vikriti and tell me what is high, what is low, or what is affected based on these three. Three Vata doshas, Pran, Vyan, and Udan. Three Pitta doshas, Alochak Pitta, Pachak Pitta, Sadhak Pitta, and two Kapha doshas, Avalamba Kapha and Shlesha Kapha, related joints. These are affected. So total of 1, 2, 3, 4, 5, 6, 7, 8, 8 symptoms have been put in the Vikriti. So based on this, anybody want to help? I will help you guys. Anybody want to take a shot at guessing what the Vikriti is? Suffice to say, this is not 100% correct. So anybody want to take a shot at this?
Wouldn't it be a higher pitta?
Absolutely. Yes. So this is wrong. Pitta is not low. Pitta is actually high. So this is actually high. So Pitta has gone high. Vata has also gone pretty high. So it's gone all the way. You can write. And what about Kapha? Kapha is actually, let's go back and, is Kapha high or low? It's dryness. There's not enough Kapha, right?
Oh, that's good, because I was wondering how the Vata could be so increased and the Kapha would also be increased.
Because when Vata is increased and Pitta is increased, it's going to dry out the Kapha, meaning Kapha has gone low. And when a person has asthma, they don't have enough Kapha in the lungs. They do not have enough lubrication, right? Mostly. So let's go back. That means, here we go. Let's start again with this. So yes, Vata has gone up, Pitta has gone up, but Kapha has dried out, has gone down. So the correct Vikriti would be, you can say V3, V4, P4, K half. I mean, I don't like to use numbers. I actually like to use arrows. They're easier. So now based on this and the Agni, does anybody want to take a shot at how are we going to start balancing it? What is our first step?
Would we first work on the Pran?
Yeah, absolutely. You would definitely work on the Pran. Absolutely. Normally we want to work on Agni first because Agni can burn up everything. But in this case, the person doesn't even have energy to digest their food, right? So this is an exception. We will all start with Pran. But usually when, Agni is low or Agni is too high or Agni is Vishama, basically we need nutrition. And if another way to look at it is, they're getting acidity, their Agni is too high, maybe their body is burning up Pran very fast. So when someone has like autoimmune issues, we say Tejas is burning Ojas, meaning Tejas is literally burning the food and nutrition sometimes. So yes, in this case, we definitely want to work because even for digestion, even to get that good Agni, you need to have good Pran. But in this, go ahead.
Sorry. Would the increased Pitta and Tejas also be the cause for the Kapha reduction in Ojas?
It could be. It could be, but remember, this is a very like a limited form and we don't have this person to ask questions. This is why we have you guys presenting the case study so we can, probe further. What happened? Did you ask? What did the person look like? Yeah, that could absolutely be the case. Absolutely. But not knowing, who this person is and we don't have anyone to ask questions, I would want to start with addressing the Prana and Agni together because maybe burning up Pran too. But yeah, even to digest food, even to get your Agni in balance, you need energy. Energy is needed for everything. And remember, we're going to go further and we will discuss Ama. Sometimes the cause of low energy is Ama. So you seem like it because Ama probably happened 3 months ago or 6 months ago, but this person has had years and years, right? So I would probably want to look at their tongue, see if they have malabsorption. Maybe their body does not absorb food. So yeah, I mean, this is only, I would say 30, 40% of if you remember the case study that we did yesterday, the Dr. Andrew Bowman's case study, he could say this was the nadi, this was the pulse assessment, the tongue had ama. So we had a complete picture. So we don't have a complete picture, but knowing where you are in Tridoshas, I really just basically want you to be able to figure the Prakriti and Vikriti. Is it making sense? And knowing Agni, you will do Pitta and Vata pacifying diet for the Agni, and you will increase prana. How do you think you're going to increase prana in this person? Anybody? Anybody want to take a shot at this? How do you want to increase prana?
Would you do like pranayama and yoga to start with?
Even to do pranayama and yoga, you need energy.
What about sensory therapies?
Yeah. We don't
Even
know.
restorative?
Yeah, we don't know what's going on. Let's go and look at what else it's been written about this person.
Even if it's restorative yoga, because if she's
Yeah, restorative would be beautiful. Yeah. So another thing, when a person has low energy, you also want to look at if there's sattva, tamas, and rajas. If it's a kapha person, tamasic, you do not want to send them to restorative. They will go down and sleep for 60 minutes, and you will increase their kapha. So do not send a kapha person for restorative yoga if their tamas is high. So you want to look at the state of mind. You want to increase the state of mind to sattvic. So this person says balance vata, which include prana, and pitta pacifying diet and pranayam. So how do you suggest it? Okay, look back, look at the symptoms again. It tells you low energy, sleep difficulties, gastric reflux, and this person has had low energy for years and years. What is the first question, Mandy, as a nurse? What is your first question? Laura, are you there? What is your first question as nurses? Look at the symptoms, tell me what is causing, what could be causing it. We could be totally wrong. First thing, has anybody had a time where they have not slept for 2 nights in a row, or 1 night in a row, or 3 nights in a row? Anyone here?
Are you meaning like mentally?
Yeah, I mean, if you cannot sleep, if you have insomnia and you have sleep difficulties, chances are that just looking if you do not sleep well, then you will always have low energy. Has anyone had that? You had some sickness, or you have a baby and you can't sleep, and you're just low energy because you're spaced out and zombie-like, and low energy because you couldn't sleep well. So personally, I want to ask.
Hi.
Hi.
I think I would ask about actually what their sleep habits are, and then also probably what they're doing regarding overstimulation of the senses, for instance, like too much computer or things like that.
Absolutely. So yeah, we don't know because, like this person's not here to answer our questions, but you're right. I would go the route, as soon as I look at the symptoms, I want to say, okay, and she says I've had low energy for whatever, 10 years. I actually had let me tell you about my client, a real-time client who had a very low energy. She was menopausal with hot flashes, very, very pitta vata person right now, very pitta. Like, she was just sitting in front of me, had 2 hot flashes, her face turned completely red in front of me, and I'm giving her my herbs, like, take them. And she said, I haven't had a decent night's sleep in 22 years. And she was always low energy. She lived on ginseng and these herbs. Now, this is a little bit more difficult. So, and this was all, she said that most she's ever slept in a night completely is 3 hours. So,
would taking stimulants further vitiate vata? Because wouldn't it make you expend more energy than you actually have to give?
Yeah, but yes. I don't know about much about ginseng, but ginseng is very similar to ashwagandha. It's a little bit more expensive, but it's similar to ashwagandha in energetics. As far as I know, it is a heating herb. So for the vata in her, because when you have sleep difficulties, you're going to have low energy. You can't just go, unless you're 15 years old or something. You have to get a good night's sleep. And there are studies, a good night's sleep is a remedy to so many things. In her case, with my client, I said, I want to reduce your hot flashes, because she came to me for hot flashes. She didn't even care about the insomnia. So she took, melanin, and she took all of these things. So the herb that I gave her while she was sitting in front of me, I gave her a Maharishi Ayurveda herb for hot flashes. Within 10 minutes, her hot flashes died out, and she called me the next day. I haven't had a hot flash for 24 hours. I need the name of that herb. I need that. So anyway, we took care of the hot flashes with that herb. In fact, if she would have 2 of those herbal capsules, she would feel cold. So it had to be a very, very, right amount for her. And my second thing was the sleep thing. So I gave her Ayurvedic herbs, including Bringaraj, Brahmi, Indian valerian, Tagara, and also, hot milk with nutmeg at night. And in the beginning, her sleep only went from 3 hours to 3 hour 10 minutes. Then 3 hour 15 minutes. Then, when she reached 4 hours a night at a stretch, then she came and she got me like flowers or something. And I think we got her to like 5 hours solid. And for that, she was grateful. But this is how, you can't just change anything. That was a big win for me, going from 3 hours to 5 hours. So that was my client. So I would definitely want to work on the sleep issues. And yes, I don't know who that was, but sometimes people sleep with the TV on, or maybe they just watch TV and eat, and then they try to go to sleep. These are little things. You actually have to have a way of winding down at night. So there's many routes you can take this, but we don't know what's happening. But that's, you guys are on the right. If you want to address low energy, you could also give ashwagandha for low energy. Let me just write that down here.
I have a question.
Sure.
Also, if they're older women or have the chronic low energy, would it be appropriate to ask if they have ever had their thyroid hormones checked?
Oh, absolutely. It would be absolutely
like some women
appropriate.
get the thyroid issues.
Yes. Yes. I'm assuming, obviously, low energy, they already have, the first question you're going to ask is, usually people who have had low energy, they've already been to the physician. They've already been tested for whatever, the Epstein-Barr virus or any fatigue syndrome and thyroid issues, so that you want to get it out of the way. They're not anemic. They do not have mono. They do not have any virus. They do not have, a tick disease. They do not have chronic fatigue syndrome. They do not have, so this is all, and still their energy is low. I get people who have been on, which I can't name the medications, but on thyroid medication, and it has helped them for 2-3 years. But now their physician wants to increase the dosage because it doesn't work as well. And they're like, if we increase the dosage, I get symptoms. Can I get a supplement? So they want to use Ayurveda as a supplement. Any questions?
Hi, this is Hannah. I just wanted to add that I am predominantly Vata, and I work overnight, and so I have awful sleep habits. And so this is a big part of like my studying the whole thing. So there's so many things. I realize that sleep is such a huge part of health and the ability to accomplish anything. So that's all.
Okay. So I'm going to take a little break. I think I need a little tea, maybe a 2-minute break, and then we'll come back and discuss another study. Is that okay? I'll just leave the case study on here for you so you guys can read it while I take a break. Does anybody want to take a shot at this? Look at the Vikriti. Is this correct? Yes, no?
I definitely think that the Vata would be increased. And the kapha would be decreased since they have dry and achy joints.
All right, let me go through this with you. Yes, so dry and achy joints mean kapha is decreased. Absolutely. So it should be less than K1. You could make it, could put a, that's a good catch. Let's just look at, you think vata should be decreased or increased?
Higher.
Increased.
Apanavayu, 1. Samanavayu. Pranavayu, but they don't tell what high energy, but it does not for feeling anxious, headache. Okay. Anxious or headache is not necessarily meaning. Oh, she means she has high prana. Now this is a good one. High prana. This is an example. Pranavayu. Okay, you're right. It has very, very high. In fact, I would take this. Let's look at pitta. What is happening with pitta?
Pitta would be decreased, I think, since it has low body temperature and also a regular digestion.
Yeah. And also lack of clarity. All the pittas are decreased if you think of it. Low body temperature, craves heat.
Would the gray skin, the skin color, also do decrease pitta?
Yeah, the pitta is decreased. Malabsorption means pitta is decreased because if you have good pachak pitta, then it's perfect digestion. Lack of clarity, bad memory. Oh, that is definitely right. Full marks. Awesome. Let's look at Kleda Kafaloloda. Yeah.
Is it pretty common for kapha to naturally go down if vata increases significantly?
Also, if pitta increases significantly, then vata but then vata also goes down because I think when pitta goes up, there's too much fire in the body. The too much fire in the body can dry out kapha, can also vitiate vata. If there's too much vata in the body, it can definitely affect pitta and kapha, both. It can either, so vata can affect both, vata going up and down can affect both pitta and kapha. Pitta will mostly affect kapha and kapha will mostly affect kapha. But vata is the most important dosha in terms of how it's affecting. But usually if vata goes up, kapha goes down, yes. Because when vata is going up and increasing dryness, that means what is it drying? It is drying the kapha out. So yes, you're right.
Why are dry joints associated with kapha? Because I guess I thought of dry, associated with vata.
So I think there was some confusion when we started doing it. When we talk about shlesha kapha and dry painful joints, is they're dry when there's when the joints pop.
Isn't that because kapha is all the synovial fluid between the joints as well?
Yes. So if someone has an inflammatory condition of the joints or an arthritis, that would also be shlesha kapha. This is just one of the symptoms. There are many, many symptoms. So any arthritis, any issue related with the synovial fluid, inflammation of the joints, all of that is related to shlesha kapha, yes. But is it making sense? Is it making sense? I mean, seems like you guys are getting it. So tell me, how would you, let me just clear this. What would you, the protocol vata pacifying diet, is that correct? Yes, no? Yeah, that's why we are doing this. So, I could just lecture you for the entire next month also, but I don't want to. I would rather you watch the recordings of the lecture and then we apply what you're learning in class. That's what you're doing on Saturdays, that's what we're doing on Sundays. Now what you did yesterday, the client, now one of the client encounters you did was a practitioner client encounter. The one Andrew had, the one Connor and I were, the hemorrhoids, the Rakta Arsha. So you have an idea what it's expected out of a practitioner one when someone, so you need to know their history. And then we did a counselor one, the New York teacher who had, issues and low energy and so on. And this is a client encounter for AC 103. So this was done by what we used to call Block 1 meant AC 103 before. So you're seeing the difference in different client encounters. As you go up, it becomes more and more and more complicated. So by the time you get to the next level, your Agni assessment and Prakriti Vikriti should be down. Like it should be down. You should know it. All right, shall I do another one? Very quickly, malabsorption. Malabsorption is again indicative of Pachak Pitta too. So that's a good one, definitely. Okay, let me share another one. All right, this one's a good one. All right. Let's look at this. Is this the same one we just did? No, this is number 2. Yeah. Right off the bat, let's look at the low energy. What is and go to pran. Low energy, what is it? Easily fatigued, lack of clarity. So we don't know. So obviously the questions we're going to ask at this point are related to, are you getting enough sleep, or have you been to a physician? Do you tend to be anemic? And of course, you can always check, you can look and tell it, but if a person is anemic, look at their nails, look at their conjunctiva. And the next question is gas and constipation, which would be related to Agni. And this person does have irregular appetite, gas, constipation, right? Let's look at their Apanavata, urination issue, occasional constipation. So urination issues, urinary frequency and urgency. So we don't know what that is there for. That also usually means high Apan as well. And short-term memory difficulties is again pran. So there's 2 pran, issues going on. So yeah, that would be one of the main things you want to address. Secondary things, and again, lack of clarity related to pran and sadhak pit. Secondary things that are going on, dryness in joints, I don't think that's such a big deal. Pigmentation of the skin, not such a big deal. Most important thing would be the urinary urgency, low energy. So I'm just going to open it for discussion. If you guys can go and give your comments. Stephanie, is it for this particular, the The one that you're writing. Increased Vata, Pitta, and decreased Kapha. Oh, you're answering Patricia. Okay, I understand.
Okay, it's good. I was really confused.
Okay. So yeah, no, I'm not asking you about Prakriti Vikriti right now. I just want you to look at the symptoms and look at the subdoshas and tell me if you have any questions or comments. So looking at all the symptoms, what is the one or two symptoms that raise a red flag for you? Elevated blood pressure and urinary frequency does not raise a red flag? Yes, it does. Exactly. So think about it. If someone has elevated blood pressure, they know it, they've already been to the physician, they might be on some medication. And usually with the blood pressure medication, diuretics are also given to decrease the excess water from the body. And we don't know, the urinary frequency may be related to that, right? We don't know this. So because this is a result of the medication, we can just leave it alone. So, but we can, in this case, at least give an herb. Now, what happens is if you're on diuretics, they actually weaken your system because they are forcing the kidneys to get rid of excess water. So from Ayurvedic perspective, we can give an herb that actually strengthens the function of the urinary system. In this case, just to give an example, it doesn't necessarily, just generally, just to give you an example, could be Gokshura or Punar Nava. You can note that down. These two herbs would support this. Now, because they also both are already diuretics, I would not suggest you give it because you would not know the dosages. But for a practitioner, they should know enough dosages, very, very small amount, practitioner students. So it addresses, and if the urinary frequency has nothing to do with the blood pressure or the medication, or it was there before the BP, then yeah, you want to address that first. Yeah. So then the second thing would be low energy, gas, constipation, short-term memory. What is it that you want to address? How do you, again, you address prana and how do you address prana and memory? The herb for that would be memory, prana, brahmi is one of the best herbs for memory issues. And occasional gas. Actually, you know what? For you guys, what would save and would help the urinary frequency would actually be digestone. It would be Triphala. This is an herb that is available by Maharishi Ayurveda. It's just regular Triphala with roses. It's called digestone. Or you could have a person drinking rose tea, Triphala tea, and Brahmi. So for advanced students, we'll usually ask them to give herbs that address all of these issues and help, but they also have to have knowledge of all the symptoms and the dosages. So I'm just giving you this for information purposes only. But for you guys, Brahmi, Triphala, Rose, this would be a good one. And of course, there's yoga and pranayam. And if this person you want to check for malabsorption. Oh yeah, I forgot. If someone has malabsorption, you want to help their malabsorption. A good herb for malabsorption would be, which again, you're not expected to know yet. I'm just giving you, because we're talking about it. It's called mushta. Yes, Brahmi for memory. Yes. So if between Triphala and Rose, that would help with both the uh, occasional gas, constipation, and the urinary frequency, all of it. Yeah. If nothing else, ask them to eat cranberry chutney. Not juice, cranberry chutney. If they don't want to do it, then okay, fine, small amounts of juice. But cranberry chutney for this Triphala Rose digestone, that would be good. Usually it is given for urinary tract infections, urinary tract issues. They're natural diuretics. Unfortunately, you need to know dosages. We haven't gone to the herbs portion yet. And if you have a client who is on medication, you want to make sure you always want to give the safest herb that you know maximum about. So if you don't know anything about it, do not suggest it. Triphala, we know because we've already discussed Triphala. Cranberry chutney would be good. But as you go further in your studies and we get to the herb portion, these are some of the herbs that could be, like Punarnava is also given to women with hot flashes and bloating and so on. Each herb has a different function, but Gokshur and Punarnava really can be given, at least I give to people who have who need diuretics because of blood pressure issues. They can be available. So remember, Cambodia was part of India thousands of years ago. It was a land of Cambodge, Sri Lanka, Lanka, all of these. Yeah. So a lot of these herbs are found in Asia. A lot of herbs that are common to Chinese medicine are also common to Ayurveda. We are only separated by one little mountain called the Himalayas. And we also share a border with Burma. Well, Hannah, be careful, be safe when you travel. Are we done? So that was 2 case studies. Shall we do another one, or I think we have 10 minutes. We can do another one, right? And then, so tell me.
I wasn't able to go like face to face with him, so this was kind of over the phone type of thing. But it's my brother, so I know him pretty well. I don't know. I don't know. I don't know what you want. I don't know.
What were the main issues? So you want to start this is really nicely done, but we're straight away seeing, but what is this, like if a person comes to you and the first thing you ask them is, what is it that you want out of this consultation? And, I think I want you to address my energy issues or my constipation. So they'll usually tell you, and sometimes they'll tell you, well, I have, issues with diabetes. Well, we cannot address that, but we can address your, this one issue. So you always want to start a consultation with having setting intention, just like in a yoga class. Just it's not so that the interview so the interview doesn't go off in a tangent and segues out.
Okay.
Even if it's your own brother. So what is it that you want? Like I have done my brother's consultation. Now I've been doing it for like 20 years. So he knows. So he will write down chief complaints. Do not tell me what I need to eat. Just address this. Give me an herb. So that's what he tells me.
Yeah, he was kind of looking for, I guess, guidance to see if he was doing things properly and like eating right for his dosha and stuff like that. Like he just really wanted guidance and what if he was doing things properly and eating right and like all that kind of stuff.
That's perfect. Exactly. So the intention, and so I'm going to go and make a little change if that's okay with you.
Of course.
Okay. Is that good? Wanted guidance about his dosha and lifestyle?
Right. Yeah.
Yeah. So that is a good one. So P pitta predominant, fast for breakfast. Doesn't eat breakfast and he's pitta.
Mm-hmm.
So what did you tell him about that?
I told him that he needs to eat breakfast. I know because he leaves for work really early, so he doesn't really like to eat food first thing in the morning. But I told him he does need to get up and start to eat food.
So in this case, when you have a person who has to leave early in the morning, and it's not them that they don't want to eat, it's their lifestyle, and it's also their condition to get up in the morning, get in the car, and they'll usually eat in the car. And obviously, if it's possible for them to actually eat something before they leave the house, that's the best. But
Okay.
better to eat in the car than not eat at all.
Right. Okay.
So, ask him to pack something and maybe almonds, something, he's mostly pitta, and I'm surprised he doesn't get any acidity or acid reflux and issues because he's young. But he will start getting those issues if he does not stop fasting for breakfast.
Yeah, and he drinks a lot of coffee too. I'm
Yeah.
surprised he didn't mention anything about acid reflux or anything like that. Only when he eats like really greasy, oily foods, he says that it starts to irritate him.
So I think this is what he's doing, and I know kids do this too. As soon as you get up in the morning, if you're having 1 or 2 cups of coffee, and coffee has milk and whatever, it actually fills you up. So he's using coffee to suppress his appetite, if you think about it.
Right. Right. Yes.
So if we tell him have half a cup of coffee and something to eat, some almonds, some soaked almonds, some raisins, one of those, the trail mixes or something like that.
Right. Yeah.
And just to start him off with, then ask him to eat. Just something that he can take in the car, just to get him started. And then if he's drinking less coffee, then he'll have an appetite. Any mom will tell you if a child takes juice, they don't want to eat because they would rather just take juice. So what the coffee is doing with coffee is sugar, coffee is milk, and coffee is tasty. So it's filling up. It's filling up, and that's why. So right now, it's not going to do anything, but moving forward, that is going to cause a lot of problem. There's something called, and he's going to like it. I just gave it to someone else. It's called Ticino. Let me comment here for you. Where did it go? Here we go.
And I think Stephanie had asked if there's milk in his coffee. I'm pretty sure he drinks a double.
What's a double? What's a double?
Oh, right, Canadian. 2 shots of milk and like 2 tablespoons. Yeah, Tim's, and 2 tablespoons of sugar, in like a medium coffee. So it's very sweet. Yeah, Tim Hortons in Canada.
Oh, I see. There's a drink called Ticino. It kind of tastes like coffee, but it's pretty Ayurvedic. I don't think they meant to make it Ayurvedic, but it has barley and dates in it, and it has roasted carob and chicory. And
Sounds good.
it's really, really tasty. Even just to do half a cup of coffee and instead of 1, just reduce it and eat something. Or at least you want him to add milk to the coffee if he doesn't. The reason being, milk actually reduces the effect of the caffeine as well. And then another thing is juice or just juice till he feels hungry. So he's basically suppressing his appetite by taking sugar, because juice is just sugar and water, right?
Weight is a thing for him. Like I wanted to go with he is more kapha because he's a heavy set guy, but when he eats properly, he's not. I don't know, he might be high kapha too.
I think he might be kapha too. The reason is if he was pure pitta, then he would have had acidity. And if you have a good kapha, then you don't get acidity easily. All the coffee and no acidity, I think because his kapha protects him.
Okay.
And
That makes
kaphas love to drink juice. They would just juice it out all day. And
He
it may,
loves milk.
that's the pitta in him who loves milk. No, I
Okay.
think adding a little bit milk in the coffee, reducing the coffee, maybe alternative to chino, and just a trail mix almond, something, to go with that. And if the juice can be a vegetable juice, like a orange carrot juice, or not orange so much, but a vegetable, carrot or something mix instead of fruit juice to start with. You have to give baby steps. If you tell him stop juicing, he'll say, "What do you know, sister?" So,
No, he listens to me. He
he,
knows.
so maybe you want to say, okay, you want to add some vegetables to the juice, maybe some
Okay.
kapha pitta pacifying vegetables. Uh, Carrot is a natural diuretic, good for both kapha, also for pitta. Then you can add, what else? What other vegetable? You could add ginger to the juice, like a ginger or turmeric to the juice. Apple juice. Okay, here's one. A little bit of apple juice with maybe kale. I don't know if you like that. Carrot, turmeric, and ginger. Now remember, we are not really into juicing in Ayurveda. This is not a
Right.
good thing. So, but only because you want to give him an option just to start with, this is better than nothing. Another thing is it gets cold in Canada just a little bit, doesn't it? So
Mm-hmm.
you probably want, see if he wants to take more soups.
He loves soups. He makes a lot of soups and stews.
Beautiful. So everything else, I think he has. I think, yeah, because very, very hungry, does not feel heavy after meeting, definitely. He has a really good immunity, seems, because
Mm-hmm.
he's eating all of this, and he can handle his alcohol, obviously. Soft stools is all pitta stool, pitta
Mm-hmm.
kapha. Uh, yep, sinus congestion. There's kapha in him. Strong nails,
Mm-hmm.
thicker skin. This is all kapha. So he would be, yeah, I would say he's probably closer to, kapha is closer to pitta. So he would be a pitta kapha person.
Okay.
Yeah, I'm going to open it for others if you want to just look at this and ask questions.
When you say he's more a Pitta Kapha person, do you mean like his original Prakriti, or you mean like the Vikriti?
Well, right now I'm talking about Vikriti because I'm basing it on what he likes to eat and basing it on his stools and bowel movement. So he has soft stools, one bowel movement in the morning, hair is soft, balding on top, medium energy, good sleeper, strong nails, oily, thick skin. All of these are things that he is now, not when he was 13 years old. I
Okay, I
don't.
was just making sure.
Yeah, so this would be Vikriti right now. So I'm talking about Vikriti. It is possible his Prakriti is same as Vikriti, but I have not seen that form. So right now his knowing the Vikriti is important because when we give the protocol, we will give protocol for Pitta Kapha. I already chose like the apple juice, kale, carrot, turmeric, ginger for Pitta Kapha, cruciferous vegetable soups with cruciferous. And I'm just going to take one more minute to, let me not record this. Hannah, close your ears because I'm going to discuss the, she has not submitted her.
Okay, closing my ears.
Okay, no, I'm not. I'm going to give you just pass marks on this quiz then.